Smooth 98.1, love music, love life. 18 minutes past 5 p.m. It's a lovely, terrific Thursday. And we are getting into the time to talk about your health because this is Smooth Health on the Drive, where we talk about health issues and, of course, wellness tips and tricks. And, of course, we, should I say, scatter those myths, shake those tables, and just correct some notions about certain issues, ailments, conditions, and so on and so forth. Basically, this is an avenue to learn about how to have a healthier and happier life as well. And this evening, we're going to be talking about a topic that affects millions of people worldwide, and it is Parkinson's disease. Now, World Parkinson Disease Day was on the 11th of April, 2024. And of course, it's important to actually talk about this because we might say, oh, Parkinson's disease, I mean, it's not a Nigerian thing. That actually isn't true because, I mean, from a lot of studies that have been going around and which actually is something that is very, very common with Nigeria, the underreporting of certain ailments. So it, let's not feel that, oh, it's not a Nigerian thing, a Nigerian ailment, and so on and so forth. It definitely affects people here as well. I mean, Parkinson's, talking about it, it's a neurological disorder, and it can have a profound impact on individuals and families as well. I mean, from Lagos to Kano and so on. A number of Nigerians probably are living with this condition, and today we aim to shed light on its various aspects. And joining me this evening to talk about this, to shed more light, and of course, break those barriers and share solutions as well, is Dr. Lilian Ochayi. She is a public health physician. Very good evening to you, Dr. Lilian. Great to have you on once again on Smooth Health. Dr. Lilian, can you hear me? It looks like we're having a little bit of a technological hiccup. Dr. Lillian, if you can hear me, we're live on the show right now. Talking about being live on the show, you can be a part of the conversation by joining in on WhatsApp and sharing your thoughts as well on 0809 981 0809 981. That is the WhatsApp number. And you can also come through and join us on the live stream on YouTube. It's at Smooth 981 FM Lagos. So those are the ways that you can be a part of the conversation. Any questions you might have, anything you might have heard about Parkinson's disease at one point or another that you'd love to share with us, or if you know anyone that probably has been diagnosed with Parkinson's disease, we'd also love to get these thoughts and just give us a better understanding of what you have been experienced, or if you know someone who has been experienced or taking care of someone who has Parkinson's disease, you can let us know so that we can also have a good idea. Because these issues of uh, ailments being underreported, we have a serious data problem in Nigeria, and that is something that needs to change if we're going to get the appropriate numbers and be able to also prefer the appropriate solutions as well. We're going to get Dr. Lilian Ochayi back on board as soon as we can so we can continue the conversation. Stick around and keep listening. This is Smooth Health on Smooth 98.1.
Hello?
Your network wants to
I'm
get
so
involved.
sorry. I'm so sorry.
Okay, you're back. Let's jump.
Yeah,
Okay.
okay.
All right, we are back. The gremlins are out of the system. And finally, we have a Dr. Lilian Ochayi on board. Very good evening to you, Dr. Lilian.
Hi, good evening, Aya. How
Great
are
to have
you?
I'm very well, thank you. Great to have you on Smooth Health once again.
Mm, Thank you. It's good to be here.
Alrighty. So, talking about Parkinson's, as I said earlier, I just, touched the surface, talking about how it's a neurological disorder, but you are the doctor. So, can you explain uh, more in depth what Parkinson's disease is in simple terms for our listeners who might not be familiar with it?
Okay, yeah. So, you mentioned already it's a neurological disorder. We say it's neurodegenerative, and it usually affects motor functions, means your ability to move
Okay.
basically, and it also affects there are also non-motor symptoms that patients could present with. So from what we know, it's a disease. It's caused the cause particularly is unknown presently, but we know that it affects a part of the brain that produces dopamine, and dopamine is responsible for modulating movement, mood, sleep, concentration, cognitive function, and things like that. So, with this area, being destroyed or dying, it leads to reduced levels of dopamine, and then we have people with Parkinson's disease. So there's it usually happens in older people, but we can also see cases in young people also.
Oh, wow.
So yeah, yeah,
Now, that actually is interesting because I always thought that Parkinson's was a disease that affected older people. And, talking about older people, when we talk about Parkinson's, for many people, the first person we think about is the late Muhammad Ali, who suffered with Parkinson's before his eventual passing. And of
yeah.
course, Muhammad Ali was a boxer, so he suffered a lot of trauma to his head over time, and that was actually highlighted as the main reason for him developing Parkinson's disease. So looking at what Muhammad Ali lived through before the Parkinson's disease began to manifest and show in him. So is it safe to say that those who are engaged in activities uh, that they suffer head trauma on a regular, they are more likely to develop Parkinson's disease? Would that be a correct assertion?
Um, in his case, they did mention that, yeah, that could have been related to why he developed the disease. But basically, presently, we're all still just not sure what exactly the cause is. We're just linking it to things. There's the genetic link, them where we say,
Oh,
okay, it's hereditary. And then they're also finding that some environmental factors also may put you at a risk of getting this. So we don't know right now exactly what's, we're just trying to find links basically. So yeah, that's where we are at right now.
it's actually really, scary sometimes when we hear about certain diseases or ailments that we don't really know what causes them. I mean, they happen, and over the years, science has been trying to explain why exactly it happens.
Yeah.
I mean, to a degree, if one knows, okay, this thing is caused by this, and then people who don't have that particular ailment can then begin to adapt their lifestyles or change their lifestyles, as it were, to avoid getting that disease or illness. But when you don't even know what causes it, that
Yes,
is
not
another
yeah, this
level
makes it
entirely.
very this is it makes it difficult to, because you can't avoid what you don't know. Like, really, we have no idea. But we just know that, okay, if there's a family history, there's a chance you could get it, if you're
Okay.
exposed to some toxins, pesticides, things like that. There's also a possibility, but we're not 100% sure yet. So yeah.
Hopefully, science can provide some answers as soon as possible. But let's talk about symptoms of Parkinson's disease. What are some common signs and symptoms of this disease that people should actually watch out for, especially in the very early stages? So maybe they can catch it early on, perhaps?
Okay. For symptoms, they tend to start out subtle, like in a very subtle way, and the
Okay.
presentation is quite different among patients. So you might get a patient that comes with tremors. You might get a patient that comes with stiffness, like one could present before the other, and you can't
Oh,
really say it has to go in this particular like after this it goes to the next and that. No, but the symptoms that the major symptoms that affects the motor function that we know are tremors at rest. You see
okay.
the yes,
Person begins to
shaking.
shake.
Yes, the lips, fingers, legs, arms, hands, and the likes. And this tends to improve with purposeful movement. So it usually occurs at rest. So it's worse when they're at rest, and when they move, it gets better. Then stiffness of the extremities. You notice that maybe your arms don't swing when you're walking, things like
Hmm.
that. And they could also have abnormal gaits, and there's
Okay.
also freezing up, like the muscles tend to freeze up. They can't move their muscles voluntarily, so they also have a posture where they are seen to bend forward as they walk. That's known as shuffling gaits. Then there are
Hmm.
also slow movements. That's also a symptom. They can't move as fast or in the normal way
Normal way.
that they would, yes, previously. So these are some motor symptoms. And there's also non-motor symptoms like constipation, depression, sleep disorders, cognitive disorders, difficulty concentrating or multitasking, loss of smell, and things like that. So they could present in, different ways. And this makes it difficult for us to be able to determine initially what this is, especially in when patients present with these symptoms. It might just come with constipation, that has been going on for some time, and you might not think that, this is what, the cause is. So it
Okay.
makes it quite difficult. Yeah.
Hmm. I can just imagine. I mean, you said so many ways it could actually present. That's probably a doctor's nightmare. But you know what? We actually need to take a pause right now, and then on the other
Okay.
side, we'll actually bring it home right here to Nigeria and talk about
Nigeria.
this from a Nigerian perspective. Don't go anywhere, Lagos. Stick around and keep listening to Smooth Health on Smooth 98.1. We'll be back in a bit. Just a minute. I need to drink water.
All right. So sorry about the network thing.
It's fine. It's fine. Hmm. There's a message here on WhatsApp. What's the difference between Parkinson's and stroke, and is it contagious?
Okay.
We'll deal with that when we come back in. Is it contagious? That's a good one. This is why we have these conversations anyway.
Yeah.
Welcome back to Smooth Health on the Drive on your Love Music, Love Life station, Smooth 98.1, 33 minutes past 5 p.m. on a lovely Thursday evening. My name is Ayokunmi, and my very special guest is still with me on the show in the person of Dr. Lilian Ochayi. And we have been talking about Parkinson's disease, been breaking it all down, putting all the cards on the table, getting a better understanding of this particular disease. And if you have any questions or any comments about this, please come through and share them on WhatsApp on 0809 440 981 0809 440 981. You can also join us on the live stream on YouTube at Smooth 981 FM Lagos. You can see my cute get up right there. That's right. Okay, so let me go to WhatsApp and take a message. This is from Senfaju, who has four questions, like back to back to back. So I'll take them really quickly before we get back into the conversation. So he says, number one, what is the difference between Parkinson's and stroke? Number two, is it contagious? Number three, is it an age-related illness? And number four, if someone regularly hits his head, maybe a footballer, can they develop Parkinson's? Dr. Lilian, oh, it seems like the Gremlins have decided to come back, but not to worry. We're going to get Dr. Lilian back in ASAP so she can answer those questions. Don't worry, Senfajo, we definitely have your back, and she'll be answering those questions and also giving you more insight. And talking about question number three, she actually had mentioned earlier that Parkinson's is usually seen in older individuals, but lately, some younger folk have been seen to also develop the ailment. Why it happens, what causes it, science still doesn't know. So we're hoping and really praying that those questions can be answered. Why this particular disease, why this particular ailment actually develops. Hopefully, soon enough, we'll get answers to those questions. And Dr. Leland will be back with us as soon as we can get her to continue the conversation. Stick around, keep listening. This is Smooth Health on Smooth 98.1. Hello.
Yeah, hi. Sorry again.
Uh, Nigeria. I understand. Really. Okay. Okay. So did you hear the questions or should I take them again?
Yes, please.
Okay, I'll take them again. All right. Let's get back. All right, welcome back to Smooth Health on Smooth 98.1. Dr. Lilian Ochayi is back on board. We'll deal with your network issues later on. Let's get back into the conversation. So there was a message from Senfajo, and there are a couple of questions that he asked. There were four quick fire questions. So I'll take them one after the well, back to back to back, so you can then answer them. So the first question is, what is the difference between Parkinson's and stroke? Number two, is it
Okay.
contagious? Number three, is it an age-related illness? And number four, if someone regularly hits his head, maybe a footballer, hitting the ball and all that, can that person develop Parkinson's?
Okay. So can you hear me?
Yeah, I can hear you. Go on. Loud and clear. Can you hear me? Can you hear me?